Hello, everyone. Welcome to Toolkit Talks, Webinar 4. My name is Jennifer Smith, and I'm an outreach professional at the Colorado Alliance for Resilient and Equitable Systems, and we serve the healthcare and public health workforce here in Colorado. So we're going to get into the Joy and Work Toolkit. This is our fourth webinar so far. If you haven't watched 1 through 3, I would definitely recommend doing that before diving into the fourth part of this, since we've already gone over quite a bit already. So the Joy and Work Toolkit, again, was created by the National Association of County and City Health Officials, and they use the Institute for Healthcare Improvements framework for improving joy and work to create their toolkit. So let's get started here. So our fourth webinar, we are going to be going over step 2 in the process, which is identifying unique impediments or barriers, as I like to call them, to joy and work in the local context. Next webinar will be our last webinar, and we're going to combine step 3 and step 4 in that video. Where you're going to learn about the systems approach to make it a shared responsibility at all levels of the organization, and how to form that team and what everyone's responsibility is. And then step 4, where you're going to use improvement science to test approaches to improving joy and work in your organization. So as we get into the toolkit, again, I would advise watching the first 3 videos before jumping into the fourth one. We've gone over a lot so far. We're going to be on step 2 today. But before this, we've already gone into kind of the pre-work where we're talking about communication, what your communication style is, how your listening skills are. We talked about active listening, really making sure that you're using those active listening skills where you're pulling things out of people. You're asking people to tell me more about that. Why did you feel that way? What made you think that? Am I hearing you correctly? This is what I'm hearing you say. Is that correct? Just to make sure you're understanding what people are saying. We also talked a lot about psychological safety and how to make your workplace psychologically safe, and making sure that is already established before going into any of these conversations. We talked about building trust, rebuilding trust if it had been broken before. Because honestly, when you're asking staff what matters to you, they're not going to be open. They're not going to be very responsive for that conversation if they don't feel psychologically safe and if there isn't trust already there. And we can build this back by opening it up and opening up conversations, but it just takes time. And so today we're going to be talking about the unique impediments to joy and work in the local context. So that's finding those barriers and those challenges that we need to have before we can have joy and work. So you're always going to come up to challenges. You're always going to come up to resistance when you're trying to make changes. So the objectives for today in step 2 is to learn the difference between equity and equality, identify unique barriers to joy and work, and learn how to engage with negative team members. So identifying unique impediments to joy and work. So steps 1 and 2 usually happen in the same conversation and continue over time. So as you're asking that what matters to you question, like we said, the barriers and the challenges and the negative parts are all going to come up. When you're even just asking, what matters to you in the workplace, and you are trying to focus that conversation on the positive, naturally, these barriers and these things that need to be resolved and the issues, they will just come up. But having conversations about what really matters to each person does build the trust needed to identify the frustrations they experience during the workday. Everyone really must feel like their ideas and opinions and comments will be listened to before they can be open and honest. Answers to the what matters question will vary depending on the individual, the barriers that are unique to your facility or organization, your department, your program, or your team. So it's going to depend on where you are, right? And your individual experiences and where you're working, specifically what department you're in and what program and what team. So if you're doing this to an entire organization, just know that it's going to be different depending on where the people are actually working. Responses to this question and the data collection and surveys, which we'll cover in the next webinar, enable leaders to build a comprehensive understanding of what contributes to joy in work in the organization, as well as what doesn't. So all of this, again, we're going to cover how to measure all of your changes, and it's going to change over time as well as you go through the process. So identifying unique barriers and challenges to joy in work is how we can begin to address the psychological needs of humans and those team members and your colleagues. Leaders can work with colleagues to identify barriers that exist in daily work and all those challenges, and then set priorities and address them together. Build camaraderie by working to remove barriers and address them. Oh, and practice equity in respecting all voices. So you're really trying to make sure you're hearing and respecting everyone that's participating in this, which is should be everyone, and make sure that you're working to remove those challenges and those barriers. So really, the next step is to make sure that your conversations and talking with people are equitable. And there's a big difference in equality versus equity. So I would ask yourself this question: do you really know the difference between equality and equity, first off? And that's what you need to, again, work on before you start this process is, do I really understand what equity is? The Institute for Healthcare Improvement states that health equity is realized when each individual has a fair opportunity to achieve their full health potential. And they're stating it in a terms because they are a healthcare company, and so they obviously are looking at this from a health potential, health perspective. But we also can look at it as a team member and an employee standpoint. So you're making sure your implementation of joy in work is equitable. When you're starting conversations for joy in work, you have to make sure they're equitable. And so making sure everyone has the opportunity to be heard, to give input and have these conversations. Ensure you are speaking with every staff member, not just clinical staff, and don't leave anyone out of the conversation. Hold meetings when everyone can attend and record them. So maybe everyone, you're not thinking of every staff member, the people in the background there who aren't the clinical staff and dealing with patients up front. Really, it should be everyone. So it should be the people in admin, in HR, front desk, billing, cooking staff, cleaning staff, any staff, lab staff. It really should be every person in the staff that you're talking to. If they haven't had the opportunity to be heard, make sure you give them that opportunity. If they are not able to attend meetings, make sure you do record them and take notes. Don't leave people out of the conversation. That is one thing where you're not being equitable. And those people in turn will become those negative employees. They will become those people that don't feel safe in the workplace because they don't feel psychologically safe because they're not being included. So equity versus equality. So equity, as it relates to racial and social justice, means meeting communities where they are and allocating resources and opportunities as needed to create equal outcomes for all community members. Equality means each individual or group of people is given the same resources and opportunities regardless of their circumstances. In social and racial justice movements, equality can actually increase inequities in communities, as not every group of people needs the same resources or opportunities allocated to them to thrive. And that's from the United Way of the National Capital Area. So if you think of that, you can replace community with team or with organization, whatever, but you really want to make sure that you're giving everyone not just the same resources, but the individual resources that they need to make it even with other people, right? We've all seen the graphic of the people looking over the fence. They each have the same level platform to look over, but that doesn't quite work, right? Because some people may be a little bit shorter, not able to reach over as much as the taller person. So you need to increase their platform in order for them to be able to see over the fence the same as everyone else. So just make sure everything that you're doing, again, you're following equity guidelines and you're letting people know about this, even putting definitions or talking about how people feel equity is and how equitable things have been at the workplace. That can be a complete meeting and a conversation that you have with everyone as you're getting these conversations started to see what changes need to be done for the sake of equity. So one of the challenges to step 2 is negative team members, those who complain but don't participate in identifying solutions. So these are people that just probably have had a really bad time of it. Over the past few years, it's been really hard. I think there's been a lot of changes that maybe haven't been the best of changes, not changes for the better. And then also maybe they've had promises made to them and things like that, and they just are done. Maybe they're kind of like, well, this is just another change that is never going to actually happen. We're going to talk about it for a little while and then it's going to kind of fizzle out, or the changes won't be good, and or I won't be a part of those changes. And so what can happen is really this conversation can help, opening up and saying, we are really going to do this. We're going to work hard and we're going to include everybody in the conversation. But it will take time. So again, what to do when you have negative team members is you want to constantly emphasize what staff can do together to address impediments and barriers. You're going to use the improvement science methods and tools that we're discussing in the next webinar. You're going to just initiate the conversation, the what matters conversation, because that can be maybe what they needed to kind of get out of that negativity. You're going to really spend time truly listening skills, write things down, remember what people are saying, get back to them about it, clarify what you've heard, make sure you are understanding what they're saying. This is what I'm hearing you say. Is that correct? Am I correct in my understanding of what you're saying? And add the barriers identified to the notes. So write these challenges and barriers up and put them up and have conversations about them. Let people see them, and then just keep talking about them. So the whole point of the join work is really to get to these people, the negative team members, and open them up and kind of let them know, like, this isn't going to be the same thing again where you're disappointed. We're really trying to do this and we're working hard to fix things. And then emphasize what staff can do together to address the challenges in step 2. So write these down. Again, with the positive comes the negative. So write down the challenges, write down the barriers, constantly talk about them, talk about how we're trying to work on individual challenges and barriers, and just keep people in the loop and have open, honest conversations. So think about what other challenges and barriers to change can there be. I think a lot of them are having management and upper management and those executive support for these changes, following through with changes. It could be communication challenges and barriers. It could be psychological safety issues and things like that. But think about what other challenges and barriers that could be. It's best to brainstorm these before you're getting into the whole process, because you can maybe foresee some of the issues that could possibly happen and kind of meet them head on before things get bad, before it becomes too much or something that you should have changed earlier and you didn't. So work through these with your team and just think of all the barriers and challenges to change that there could be, because there can be quite a few challenges and barriers to any kind of change. So the purpose of the conversation for why you're asking members to say what matters to you. So things to do could be asking members to share what gets in the way of what matters, what gets in the way of a good day, what frustrates me in my day. Those are great ways to start getting through those barriers and those challenges, what comes up from these conversations. And then things not to do, they recommend don't stay with general or broad comments, when people are saying never and always. But what does that mean? Like, what is always? Is that a daily thing, an hourly thing, a monthly thing? Make sure you're really getting down to the details of issues. Don't allow a single person to do all the talking. Make sure that is maybe setting a precedent at the beginning of meetings. always saying, we're going to allow everyone a chance to talk. So please don't take over. I understand you may be passionate about some of these, but we can also bring that to a one-on-one conversation as well. Don't assume people know you have heard them. So make sure you're letting people know that you're hearing them, and you're actively listening, writing things down. Again, don't feel the need to solve every issue identified immediately. I think the biggest thing is just remembering everything people say and all the issues people are bringing up and following up with them. And then again, don't think you need to do this all by yourself, because this is going to be a group effort. And in our next webinar, we will go into more about how to organize and what's the responsibility for everyone. We'll get into that a little bit more. And then steps to try, of course, when you're having this conversation. And we've talked about a lot of these before, but articulate why you're talking about joy in work. Really give them that context and why this is happening and what you're really trying to do. And talk about your commitment to working together to make daily life better for everyone, and that you really are committed to this. And emphasize that this is about ongoing improvement and not a one-time or quick fix. This is going to take time. It's going to be a process that everyone's going to need to be involved in. And use brief huddles in the work area to have conversations with as many people as possible. And this builds inclusiveness. Again, with that equity, if people are really busy during the day and there's no time to meet otherwise, catch them in the hall and have a little quick conversation. Can really make somebody feel important and feel like they're being heard. So again, build on the assets and bright spots. So share positives too. So this can be a great starter to a meeting, is why I decided to work in public health or healthcare. What makes me proud to work here is this. What matters to me in my work? What is the most meaningful or best part of my work? When they know they make a difference, when is that? How do they know that? What it looks and feels like when we're at our best, and what makes a good day. So these are great starters to, again, build on the bright spots and the assets that you already have going on, and, sparking ideas for different changes that can be made elsewhere. And things not to do. So again, when you're talking about building on bright spots and assets, just don't assume all team members will understand what you're talking about immediately. They're not often used to ask what matters. They're not often asked to, to talk about things like that and to be honest. So, and don't assume all people will feel safe talking initially. You might have to build up on that. It may take a few meetings or even a lot of meetings for people to really feel safe coming out with the truth and how they honestly feel. Don't assume all people have the same view. So everyone has their different individual experiences, and you need to make sure that you're listening to all of those individual experiences to take into account what changes need to be made. And don't mandate participation, just welcome and invite that. If they just want to sit there and listen for the first few meetings or all of them, then that's fine. If they just only want to talk maybe one-on-one or through writing, maybe emails or something, then let them, be as participative as they would like to be. And don't speak for others. Just let everybody have their own opinion and their own views and ideas, and just speak for yourself. And then steps to try. So choose one question to get started, then listen and invite others to comment. So start off slowly. This is a whole new process. So just see what happens, see what comes up. And ask follow-up questions to clarify statements. So it might even be one question is enough, because everyone's going to be commenting and adding their ideas and opinions. And then you might be following up with a bunch of clarifying questions, and that may be enough for one meeting in itself. And then point out when bright spots are similar and identify the themes that you hear. So how are like everyone's having a different idea or having different statements, but then it's like, oh, you kind of are all saying the same type of thing, and how can we build on this, right? What's the theme here? And make sure you're capturing what you hear so it's visible. And I think the idea of like a whiteboard or those poster papers you can tear off, and tape up somewhere in the break room, so that really people are looking at this and seeing the feedback, seeing the notes. What are people saying? Because honestly, sometimes I'm an internal processor. I like to talk about it, then maybe look and maybe I'll gather more ideas for the next meeting as I'm seeing what's up on the walls already. So that's it for today. So um, really, it's I think this step here, the step two, is finding out those barriers and challenges. Maybe even before they happen, you can kind of preempt any conversation, before you start it, with knowing what challenges and barriers are we going to come across here, probably. Knowing that there might be some negative team members, and that's okay. The whole purpose of the Joy in Work is to really let them know that we are here listening and we are here to help and make changes, and make sure you're fully committed to the Joy in Work process, of course, before getting into it, so that you don't let people down again. Because I think there's been a lot of talk and not a lot of follow through during the pandemic, a lot of changes, a lot of change, and then go back to the same thing. And nobody knows kind of where they're going. So make sure that you're committed to the process before starting the conversations. Make sure you understand the difference between equity and equality. That is very important, because it really should be very equitable in these conversations. If it's not already, please make sure to do some more research, find out what you need to do to make everything equitable before you have these conversations. So thank you for viewing today. Next webinar, so this was webinar 4, our webinar 5, which is the next one, we will post soon, and it will be the last one, going over the last 2 steps in the Joy in Work process. Please check us out at co-cares.org. You can email us at cdphe_healthcare worker support@state.co.us. You can scan the QR code to get to our website. Again, the Joy in Work Toolkit can be found on the NACHO website, which we will have linked below, and then also on the Institute for Healthcare Improvements website. They have a bunch of information, a bunch of videos, and supplemental materials as well, so that you can take a look before starting the process. But thank you so much, everybody, and have a great day. Thank you.